In this session, we'll learn how to opt a patient out of the Alabama One Health Record Exchange. By default, the exchange will follow an opt-out consent model. All information that's not protected by federal or state laws will be available in the exchange unless a patient explicitly elects to opt out of the system. If a patient has elected to opt out, HealthShare will follow a zero disclosure policy. That means no trace of the patient will show up in any searches you do in the exchange. The utility that enables you to opt a patient out of the exchange is found on the patient search results page, so it's visible as soon as you search for a patient without you actually having to call up the patient's data. Let's say your patient Joe Testing comes in and says he wants to opt out of the exchange. We'll search for him in HealthShare using the standard patient search, which is typically done by entering a medical record number along with the associated facility, or by entering the patient's name and optionally some other demographic data to help narrow down the search. For this example, I'll just enter the patient's last name, Testing, and hit the search button. And there he is. Notice at the top of the search results screen there are two buttons. One would let me view the selected patient record, and the other is the opt-out button. Because there's only one patient that matches my search criteria, HealthShare has already put a check mark in the box next to his name because it assumes he's the patient I want. If I click on the opt-out button, the first thing I see is a confirmation box, so I have the opportunity to either proceed or cancel. If I click on the cancel button, the patient will still be visible in the exchange, so I can do the search again and still find him. Let's try that again. This time I'll click on the opt-out button and I'll say the patient really does want to opt out. Now the system tells me that the selected patient has been opted out of the exchange and will no longer appear in the search results. If I search for this patient again, there'll be no trace of him. Note that for privacy reasons, if you search for a patient and do not find that person in the exchange, there's no way to tell the difference between someone who's opted out versus someone who was never registered in HealthShare in the first place. At a later point in time, if the patient changes his mind and decides he does want to participate in the exchange, that opt-out consent decision can be modified inside HealthShare, but that would need to be done by working through the help desk using the contact information shown on the screen. If the patient does not yet exist in the exchange, but wants to record an opt-out decision, you need to manually register the patient in HealthShare first, which is also done by working with the help desk. This concludes our look at how to opt patients out of the Alabama One Health Record Exchange.